Hi there, this is a video on hypertrophic cardiomyopathy, and it's written by Aidan Smith and Alex Gavrishev. So, what is it? What is hypertrophic cardiomyopathy? Well, hypertrophic cardiomyopathy, or HCM for short, is a condition of the heart muscle that results in it thickening, especially around the wall that separates the two ventricles, or otherwise known as the interventricular septum. This makes it harder for it to pump and decreases the ejection fraction of blood flowing through it. This thickened septum will completely or partially block blood flow in 2/3 of the cases, and that's called obstructive HCM, and it'll still allow blood to flow through properly and unobstructed through the other third of the cases, which is also called nonobstructive. The thickened walls also lower the overall heart volume, which can then hinder the capacity for blood to flow as well. If left untreated, obstructive HCM can result in a number of other symptoms, including but not limited to dizziness and fainting, obviously, less oxygen transport, mitral valve disease, atrial fibrillation, cardiac failure, and eventually even just heart death. It can even lead to other forms of cardiomyopathy, such as dilated cardiomyopathy. Hypertrophic cardiomyopathy connects to DMD because it's a possible symptom of the disease. Alright, so who gets it? Who gets HCM? In a large quantity of the cases, HCM is asymptomatic, so some patients can only feel symptoms when exercising or exerting themselves. For others, the symptoms can be anywhere from moderate to severe, as if a spectrum of severity exists. And sometimes, you just can't even tell you have it. Some factors that could predetermine susceptibility to HCM include genetic mutations that play a direct role, and family inheritance as well. If someone has family members affected by HCM, it's often recommended that they get screened by a specialist in order to rule it out for themselves because, they could have it. HCM, in the case that we are concerned with, though, is caused by DMD itself. So, you have DMD already, and HCM is just a side effect of that. And the harm that it does to cardiac muscle is derived from DMD. Some diagnostic tests used in order to identify cases of HCM in patients include an electrocardiogram or ECG, cardiac magnetic resonance imaging or MRI or CMR, a cardiac CT scan, stress tests, Holter and event monitors to detect abnormal heart rhythms or arrhythmias. Genetic testing also is key here. HCM is relatively easy to diagnose once it is suspected, just because there's this wide array of methods you could go about to sort of diagnose it and deduce that that's the cause.
HCM and DMD share plenty of characteristics. Both diseases are caused by rare genetic abnormalities. Patients with either disease have struggled with delayed diagnoses. Additionally, both disorders use some of the same medications, such as beta blockers and diuretics. Although rare, HCM can occur simultaneously with Duchenne muscular dystrophy. These rare cases have occurred due to dystrophin mutations combining with additional mutations. Specifically, an excess of mutations in other genes that govern muscle function could change the course of DMD progression from forming the more common dilated cardiomyopathy to hypertrophic cardiomyopathy. No matter which type of cardiomyopathy is formed, both hypertrophic cardiomyopathy and DMD are prevalent in younger patients. While DMD shortens the usual lifespan to the late 20s, HCM is most common in people below the age of 35, which leads to these disorders affecting similar age groups. This is especially true when considering that cardiomyopathy in Duchenne muscular dystrophy appears later in the progression of disease. In a typical experience with hypertrophic cardiomyopathy, patients are frequently prescribed beta blockers, calcium channel inhibitors, blood thinners, diuretics, and an emerging drug class called myosin inhibitors. Beta blockers block the hormonal response that increases the heart rate, common beta blockers include drugs like metoprolol and propranolol. Calcium channel inhibitors decrease blood pressure by preventing calcium from increasing the force with which the heart squeezes. Examples of calcium channel inhibitors include Norvasc and nifedipine. Blood thinners are specifically utilized in cases where the patient develops atrial fibrillation. These blood thinners, such as Xarelto and Eliquis, prevent blood clots from forming. Blood clot formation could cause a stroke, so this is crucial for patients with AFib. Diuretics allow the heart to pump more easily by increasing the amount of water released from the body in urine. Some examples of diuretics are furosemide and hydrochlorothiazide. Myosin inhibitors are a newer treatment option. Myosin inhibitors have improved symptoms of HCM by reducing myosin-actin interactions, leading to less forceful contractions. In recent research, a new drug of this type has emerged. Mavacamten, which was tested in over 240 patients between 2019 and 2021, showed enough evidence of improving heart function in HCM to be approved by the FDA in April of 2022. In patients where these medicines are not enough to help symptoms improve, there exist several potentially beneficial procedures. The first of these is septal ablation. Septal ablation uses a catheter to place alcohol into the heart in an effort to shrink the heart muscle. Another procedure has two variants, septal and apical myectomy. These procedures cut out small chunks of the enlarged muscle in the heart in order to attempt to improve heart function. In the case of an individual developing AFib, an ICD, implantable cardioverter defibrillator, or a pacemaker could be installed. These devices reset irregular rhythms of either the ventricles or the atria by sending out small shocks to the area. Of the three procedures mentioned, this method is least invasive.
As you can see, hypertrophic cardiomyopathy is relevant to both DMD patients and others. According to Yale Medicine, every 1 in 500 young people have the condition, with another large portion remaining undiagnosed. With its extreme relevancy, educating ourselves on HCM holds high importance. Drugs and other treatments for the condition are always improving and being researched, which is promising for the world's population that is increasingly growing older. Thank you for watching.